Hey YouTube, Dr. Bree here from Empower Physiotherapy, helping you build a more resilient body and mind. Today I'm going to show you the beginning of my deep core progression series. So this is the foundation of all of the pelvic floor education I give my patients. And you might think that's only for people who've had babies, but that's not true. Everybody has a pelvic floor, everybody has a deep core. So even if you have a nice strong core, you just might not be coordinating it very well and managing this pressure in your abdomen when you're exercising. So that's the whole foundation of this, is trying to get that engagement to happen at a subconscious level so that you don't have to think about it when you're doing the things that you love. So let's get started. So this exercise is going to start laying on your back with your feet flat on the floor. And you might see that a lot of us have this natural arch in our low back. So what we're going to do first is try to gently flatten that. And what we're not trying to do is to use our butt and tuck it under and crunch really hard. That's not what we want. We want to gently flatten the back. Think about pulling the pubic bone up to the breastbone, okay? Gently flattening, trying to neutralize that arch. That's step one. Step two is to then try and zip the abdomen together, like you're trying to pull your ribs in together. Some people call it engaging that corset, okay? So you're trying, I don't know if you can see this with my abdominals, but you're trying to kind of pull everything in. Okay, I'm going to show you so you can see it a little bit easier. So if this is the first tuck, and then I'm trying to pull everything in. A little hard to do while you're talking. Let me show you that one more time. So step one, step two. Some people also use the belly button to the spine cue. For folks who are pregnant or just had a baby, imagine you're trying to hug the baby with the belly, zipping everything in together. So those are the first two steps. The next step is to simply do a Kegel. So if you've been in my practice, you already know how to do a Kegel by the time you're watching this video. I will post other videos on different cues you can use, and I'll link those in the description once those videos are up. But the most common cue is to engage the muscles you would, like you were trying to stop the flow of urine, although don't really do this when you're going to pee. You can give yourself a UTI. I learned that from experience. So you've done step one, you've tucked everything in. Step two, you've zipped the abdomen. Step three, you're Kegeling. And a little trick to tell if you're doing it right, find these hip bones, the ones that you can kind of see on people if they're really lean. Go slightly in front of that. And then when you do the Kegel, you should feel the tissue firm under your fingers. A little bit. If it's too much, if it's kicking you out of that space, that's more of your oblique muscle, and that's not what we want. So just a little gentle engagement, okay? And then the last step is, I think, the easiest, but sometimes the hardest. You simply need to breathe normally, and this is to engage your diaphragm. So not big, deep breaths, just regular breaths. You'd be surprised how many people hold their breath when they're going through all this core work. So let me show you this all together. Step one, gently tuck. Step two, zip the abs. Step three, engage the pelvic floor. Step four, just breathe. All right, now I'm going to show you that all without talking. Not a whole lot looks like it's happening, right? But that's it. Now you know how to engage your core. I like to call this the core imprint, and it's really important to master this before you even move on to any of the other deep core exercises. Also, you want to be really honest with yourself. Make sure you're not losing your form in one of those four places. Did you hold your breath? Have you lost the Kegel? Did you accidentally come out of your little tuck? Be honest with yourself about that. The way to progress this is to start with, can I engage all of these things? And then breathe normally for 3 breaths. So that's 3 rounds of inhale, exhale, inhale, exhale, inhale, exhale. If you can do 3, then try it again for 5. After some time, 5 will get easy, and then you can try it for 8, take a break. And after some time, 8 will get easy, and then you can try it for 10. Once you can do 10 in a row without any issue and without losing form quality, but being honest with yourself, then you can move on to the more difficult stuff where we're going to start adding movements of the body. Because remember, the core's job is not really to do a bunch of sit-ups. It has its place for that in some motions, but our core's job primarily is to keep everything still here while we move our arms and our legs throughout our day-to-day life. So it's really important that you build this foundation. Hope you like this video. I hope you feel more empowered, and please hit that like button, that subscribe button, and share this with someone who you think might benefit. As always, thanks for watching, and see you next time.